Hi, I'm Corbridge. I'm the Chief Information Officer for the Health Service Executive. I'm also the Chief Officer of an organisation called eHealth Ireland, which is a new function in Ireland tasked with delivering what we call a digital fabric to the healthcare system. My first job after university was with Pro Systems, which was designing quality systems around geographic information solutions, which I did for a couple of years. And then a role came up in the NHS as a developer and support for what's called the Health Service Systems, the HSS. They are systems that paid GPs, that did cancer screening, that connected GPs. And that was my first sort of touching of healthcare. And since then I just became interested in technology, in health in particular, and stayed along that route. So from a developer to support person to project manager, directing a large trust in the UK onto national programmes, and then over to Ireland after a little stint in clinical research looking after IT in that space. My education though wasn't IT, it was business studies and marketing and education, so actually how to teach people about business studies with a marketing theme around it. So whilst not specifically around IT, obviously it's a skill set that I feel you can learn and grow with, and also through learning and development on the job in roles, I started to get more and more interested in the technology side and what we were doing. IT people, IT professionals need to constantly adapt because of the pace of the industry we're working in. So it's almost by nature of being an IT professional, you're setting yourself up for a role that needs to adapt because you need to learn new technologies, you need to be aware of new technologies. But also, every time you're doing something with technology, you have a customer, you have a user base. And you need to adapt how you communicate, how you work with that customer base. How do you build understanding, or how do you understand the needs of the customer when you're building or designing a new product? And I think that's almost one of the more exciting parts, is the changeability of what you're doing as you go through that is a big part of it. Challenges specific to IT that lie ahead. I think we haven't yet thoroughly had the privacy debate that needs to be had around information. We want to share information. We ask a patient, is it okay to share the information? And often the patient will respond with, what do you mean you don't already? And yet we need to protect privacy. We need to give people the option to say, no, I don't want my information to be shared. No, I don't want to have digital information about me in the systems. It's a real difficulty, particularly in health, because the moment you start shielding or hiding some information, it actually makes the information that's there already clinically unsafe. You need to have the richness of a record about a patient to make it clinically safe to provide care. If it's not a complete record, it becomes something that's harder to make decisions around. Professionalism in IT, to me, it means such a wealth of different things. I think the core of it is the enthusiasm for what technology does. A professional in the IT industry wants to know what technology can do for their business area and has an understanding and continues to grow their knowledge of what technology can do. As we said, technology is moving at such a pace, staying aware and on top of the technology changes and the benefits they can bring are really, really hugely important.